I'm Dr. Anil Kuri. I'm a consultant in reproductive medicine, surgery and assisted conception at the Homerton Fertility Centre in London. So today what are we going to talk about? Something which we often ask. Can we do intrauterine insemination with one tube being open? And the answer is sometimes yes and sometimes no. So let's have a look at a paper which was done on these cases. So what is the effect of a unilateral open tube on IUI success? And this was published in Reproductive Medicine Online. And what they looked at, HSG done, and all patients with tubal abnormality was seen. They underwent a laparoscopy. 44% laparoscopy was normal. During laparoscopy, 9% had one tube removed due to a hydrosalpinx and 6% had tubal surgery. The aim was to evaluate whether doing IUI with one tube had a similar pregnancy rate to two tubes. The controls were 818 women with at least one IUI, total of 1,880 cycles between January 2007 and December 2012. And the indications were multiple: ovulation disorder, male and female causes, sperm abnormalities, endometriosis, donor sperm, and unexplained. Recombinant FSH was used, at least one follicle of greater than 18 millimeter, HCG given as Ovitral, cancellation in younger women with more than one follicle, greater than two follicles between 27 and 37 years, or more than three follicles and more than 37 years. So let's have a look at the pregnancy rate. So if you had two normal tubes, the cumulative pregnancy rate was 36% and the live birth rate per cycle was around 16%. As soon as you have one tube normal and one abnormal, then you're looking at a cumulative pregnancy rate of 18% and you're looking at a live birth rate per cycle of around 8%. And then you split it up into what happens when one tube was removed, which means you had a hydrosalpinx, and probably the tube on the other side was also damaged, but it was patent, and then they saw no pregnancies. If one tube was occluded, they tended to see about an 8% pregnancy per cycle, and if a tube was altered and the other patent, you saw about an 8 to 9% chance. If you had previous ectopic, the chance of pregnancy was around 10%, and previous tubal surgery, again 14%. So what does this study tell us? It tells us that the cumulative pregnancy rates were significantly decreased in all types of unilateral tubal abnormalities. It's one of the largest studies which has been done, and that's the reason why I'm presenting it. There were similar studies in the Journal of Obstetrics and Gynecology where controls at 44.7% versus 26.4% in the single tube. Some people believe that if you have a distal blockage and not a proximal blockage, the decrease of pregnancy takes place. There are other studies which showed no difference. And in this study, we see the linear blockage was around 12.3%, while in other studies, the blockage has been much higher. Now, the hypothesis is that if you have disease or if you have infection affecting a tube, it tends to be bilateral. And thus, if you remove hydrosalpinx, which is due to an infection or inflammatory disorder, then on this other side too, that effect may have been present, though the tube may be open. And that's something which we have to have a think about. So at present, what did this study conclude? It concluded that if you have a unilateral tubal abnormalities associated with a dramatic drop in pregnancy rates, IVF is the preferred option. And again, if you plan to do an IUI, then look at the woman's age, because that is something which is important in terms of having the best possible outcome is by doing IVF. And if you do it for younger women, if you do IUI, just be very careful and explain to these couples that pregnancy rates will be lower. Again, thank you very much for watching this, and if you have liked this talk, please share it and let others have a look at what evidence-based medicine could be around, and this will help us to improve general care across the world. Thank you very much.